distinct honor of actually presenting one of our alums. Dr. Olga Jonasson is the current Chief Fellow in Plastic and Reconstructive Surgery here at UIC. He completed his general surgery residency with us in 2023 and also earned a Master of Education in Health Professions the same year. His interests include facial reconstruction and aesthetics, surgical innovation, medical education, healthcare management, and the integration of artificial intelligence in surgical education practice. And his talk is entitled "Scalpel, Prompt Like a Surgeon."
Hi everyone, I'm Olga, and for those of you who are wondering if I'm ever leaving here, I actually am, in a couple weeks. So you walk into the operating room, you scrub, you gown, you prep, and you say your famous first word, "Scalpel." And that's typically not just a request, it's more of a signal. It's a signal that the operator is ready, that the room should come to order, the plan is structured, the team is aligned, and that the next move should be very deliberate. But let's back up a little bit. You're a surgery resident. It's the night before a complex reconstruction, you're home late as usual, you're too tired to prepare, you pick up your phone in bed and you open Claude, or ChatGPT, whatever your choice is, and you ask it about how to reconstruct this complex craniofacial defect. And as usual, it gives you a fully organized, very confident review. You love it, you put your phone down, you've got this. So the next morning you walk in, your attending as usual asks you what your plan is. You're as confident as your AI friend, and you answer without any hesitation. That's when your attending looks at you and gives you the, what on earth are you talking about? Because what you just answered doesn't make any sense. It really doesn't apply in general or to this patient or any other patient. And let's just say for the sake of this patient's safety, you didn't get to hold a scalpel that day. So what happened? AI didn't really lie to you. It just extrapolated, confidently, but all it did was extrapolation, and with complete authority. It was just the surgeon who never held a scalpel. So here's what the reality is. AI is not really a database like most people think. It's a form of autocomplete, the most sophisticated autocomplete ever built. It just predicts the next word, until it comes with something predictable. It just predicts things assuming that the existing trends and facts should apply every time. It doesn't really apply every time in surgery. It really cannot tell the difference between what's right or wrong. It will hallucinate a perforator that doesn't exist, or cite a paper that was never written, or give you a drug dose that can kill an elephant. And if you confront it with it, it will simply apologize and probably praise your intelligence afterward, which is why we like it so much. Because to AI, consequences don't really matter. It will not really present your M&M, it will not do your flap checks at 2 in the morning, and definitely will not really tell the family why the flap died. It may be the most confident voice in your head. It's really in your head at this point, but definitely will not take any responsibility for your mistakes. And that's a problem, but it's not really a problem because avoiding lethal mistakes, it's what we do best as surgeons, or I hope it's what we should be doing best. Because we know that confidence without structure is what gets our patients killed. And that's why we have protocols. We may not like them so much. We have all these checklists, timeouts, but they're there for a reason. And following them is really what protects us from ourselves. You don't really typically walk into your surgery unprepared. You think, you analyze, you leave nothing for assumption. Yet when it comes to AI, that you have made it very integrated in your life and you're so dependent on it nowadays, you walk in unprepared every single time with absolutely no structure. So I'm offering you one. And just to make you guys all comfortable with it, we'll call it SCALPEL, which is something you're familiar with and like. It's a framework for AI prompting for surgeons. Things that you need to know whenever you start to prompt. What do you want exactly? Be very specific when you use AI, because vague prompts get vague answers. Garbage in, garbage out. What is this for? Who are you? Why are you asking these specific questions? Give it context. If you're a chief resident preparing for a complex case, it will get you a completely different answer from if you were a student preparing a case report about it. Who is this for? Is it for you? Is it for your resident? Is it for your patient? Is it for your risk management team at the hospital? The answer will change completely depending on the audience. So tell it every time. What should it not do? Don't let AI go wild. Always give it guardrails. And I think this is very essential to prevent hallucination. Most people you talk to who use AI often criticize that AI will hallucinate. Well, if it does hallucinate, it's probably because you did not really set the stage right for it. If you don't want it to speculate, be specific. Tell it no speculation. If you want only peer-reviewed articles, say that exactly. Because